The shoulder joint is highly mobile ball and socket synovial joint, and shoulder joint is also known as glenohumeral joint. It allows a wide range of movements such as lifting, rotating, pushing, pulling, throwing, and so many activities related to shoulder joint. Hello everyone, welcome back to my channel, and I'm Sudha here. And today's video we will explore the anatomy of the shoulder joint, one of the most mobile and complex joint in the human body. We will cover its bones, ligaments, muscle movements, and a simple and easy to understand way. So let's get started. The shoulder joint is formed by a group of bones, joints, muscles, ligaments, and tendons also working together. So first we discuss about bones of the shoulder joint. As you can see a image of bone, and this bone name is a humerus. Humerus, the long bone of the upper arm that connects to the shoulder to the elbow, and its rounded head forms the main shoulder joint. Second bone is clavicle. Clavicle, also known as the collarbone, it connects the shoulder to the chest and helps support shoulder movement and stability. And third and last bone is scapula. Scapula, also called the shoulder blade. It is a flat triangular bone on the back of the shoulder that helps in arm movement and muscle attachment. Now we will know about joints of the shoulder complex. The shoulder complex contains four important joints. First is glenohumeral joint, second acromioclavicular joint, third is sternoclavicular joint, and last is scapulothoracic joint. So we will discuss one by one, and we will cover all the joints in the shoulder complex. Then first is glenohumeral joint, and it is main shoulder joint, and is ball and socket synovial joint also, formed between head of humerus and glenoid cavity. This helps flexion, extension, abduction, adduction, and internal rotation, external rotation, circumduction. And a main part is this joint provides maximum mobility and less stability. In this image, second joint I will cover acromioclavicular joint, and as you can see a dotted circle indicate the joint, and this joint acromioclavicular joint between acromion and scapula and clavicle. This helps shoulder elevation and overhead movement. Third joint is made of sternum and clavicle, and this is the sternoclavicular joint between sternum and clavicle. As I said, only bony attachment of upper limb with axial skeleton. And final and last one is a scapulothoracic joint. This joint is made of scapula and thoracic, and it also function for smooth shoulder movement. Now we try to understand articular surfaces. The shoulder joint is highly mobile because the large head of the humerus articulates with the relatively shallow glenoid cavity. This glenoid labrum helps compensate for this shallow socket by increasing stability while still allowing extensive movement. And this is a head of humerus. The head of humerus is the rounded ball and shaped upper end of the arm bone, and it forms the ball of the ball and socket shoulder joint. It is covered with a hyaline cartilage, a smooth, slippery tissue that reduces friction during any movement, absorbs shock, protects the bone surfaces, and the glenoid cavity is the shallow socket on the scapula shoulder blade. It forms the socket of the shoulder or shoulder joint. Because it is relatively shallow, it allow a very large range of movement. uh, and now glenoid labrum. Glenoid labrum is a ring of fibrocartilage attached around the rim of the glenoid cavity, and it's help to depends the socket, increase stability of the shoulder joint, and also keep the humeral head in correct position or place, and reduce the risk of shoulder dislocation. It is very important for shoulder joint. Ligaments are play very key role in shoulder movement. So as you can see in this image, there are four main ligaments who help to any kind of shoulder movement. First is glenohumeral ligaments. These are thickened bands of the shoulder capsule located on the front of the shoulder. Three glenohumeral ligaments: first superior, second middle, and third is inferior glenohumeral ligament. So, in short, SGHL superior and MGHL middle glenohumeral ligament, and third one is inferior IGHL in short form. So, all those ligaments prevent excessive shoulder movements, and also help keep the humeral head centered in the glenoid cavity, and provides stability during arm movement. And one more function is the inferior glenohumeral ligament is the most important stabilizer. uh, Please note this point: the inferior glenohumeral ligament is the most important stabilizer when the arm is abducted. I mean raised sideways, abducted position. It play a very key role to stabilize the arm abducted. So second is coracohumeral ligament. It extends from the coracoid process of the scapula to the greater tubercle of the humerus, and also reinforces the upper part of the joint capsule. This ligament helps support the shoulder joint from above, helps prevent downward displacement and the humeral head, and also assist in shoulder stability. Third ligament is coracoacromial ligament, and this ligament extend between the coracoid process and the acromion, forms the coracoacromial arch over the shoulder joint, and this ligament helps in protects the humeral head, and also prevents superior displacement of the humerus, and this ligament creates a protective roof over the shoulder. And last ligament is transverse humeral ligament. This ligament stretches across the intertubercle, also called bicipital groove of the humerus, and this ligament helps to hold the tendons of the long head of the biceps brachii in place, and prevents the tendons from slipping out of the groove during shoulder movement. Now we know about muscles, which muscles are how many muscles are working together for shoulder movement. So we cover here. The shoulder muscles provides movement, strength, and stability to the shoulder joint. They work together to move the arm in different directions and keep the humeral head centered in the glenoid cavity. So there are so many muscles. I will cover one by one. First muscle is a rotator cuff muscle, and we will also say it in short form SITS muscles. The rotator cuff consists of four muscles that surround the shoulder joint and stabilizes. And these muscles are supraspinatus, infraspinatus, teres minor, subscapularis. And the second most important muscle is shoulder complex is a deltoid muscle. The deltoid is the large muscles covering the shoulder. Deltoid muscle have three fibers: anterior, middle, posterior. Anterior fibers of function is flexion of shoulder and internal rotation, and middle fibers working for abduction of arm, 15 to 90 degree, and third one, posterior fibers help in extension of shoulder and internal rotation basically. As you can see in this image, so many muscles are responsible for shoulder movement. Muscles I have covered, and remaining muscle is pectoralis major, latissimus dorsi, teres major, biceps brachii, trapezius, serratus anterior. So that's a complete overview of the shoulder joint anatomy, from the bones, joints, ligaments, muscles, tendons. Understanding these structures in the foundation for diagnosing shoulder pain, injuries, and movement problems. I hope this video helped you understand the shoulder joint in a simple and practical way. Thank you for watching, and I will see you in next video. Until then, stay healthy, stay active, and keep learning.